Good morning. My name is Vani and I have come from Kasturba Hospital, Manipal. Today I am presenting a paper on prevalence of human papillomavirus in the first trimester of pregnancy, maternal and fetal implications. Human papillomavirus is a small double-stranded DNA virus, and the pathogenic role in epidermal and genital warts have been studied extensively, and human papillomavirus is considered to be the main cause of cervical cancer. Physiological process of pregnancy modifies the cellular immunity and thereby increases risk of viral infection. The prevalence of human papillomavirus was known to be 5 to 55% in various studies done previously all over the world, 13 to 28% in Asia, and 18 to 28% in India. Human papillomavirus infection was found to be associated with pre-labor rupture of membranes, preeclampsia, fetal growth restriction, and preterm delivery in previous studies. Aims and objectives to ascertain the prevalence of human papillomavirus infection in the first trimester of pregnancy and to study the maternal and perinatal outcome of human papillomavirus infected patient and compare them with non-human papillomavirus infected pregnant women. My materials and methods. It was a prospective observational study done over November 2015 to October 2016, and I've included all women with singleton pregnancies attending antenatal clinic in early pregnancy undergoing transvaginal ultrasound, and my sample size was 95. We have excluded pregnancies with multifetal gestation, other comorbidities like hypertension and diabetes, and people with immunosuppression. Methodology. The condom used to cover TVS probe was collected during the first trimester, that is before 14 weeks of gestation, and it was put in a 50 cc plastic container containing phosphate buffer solution, and the tube was shaken for 1 minute and condom was discarded, and the sample was refrigerated at 4 degrees centigrade and was transported to the place where human papillomavirus testing, that is DNA PCR, is done. The sample was centrifuged, DNA was extracted, subjected to PCR, and human papillomavirus, if isolated, the typing is done. If not isolated, the sample is discarded, and the people in which human papillomavirus is isolated, it's considered as study group, and the people in which human papillomavirus was not isolated is considered as control group. Both groups were followed up till delivery. Consort statement. Sample size was 95. In which 90 was processed and 5 were not processed because of cap leak during the transport, and HPV negative was 47, that is 52.2%, and positive was 43, that was 47.7%, and in the HPV negative people, that is the control group, 33 delivered, 2 abortions, 2 MTPs, and 10 was still on follow-up. They'll deliver around December. And in human papillomavirus positive people, 47.7% is the prevalence, and in these people, 35 have delivered, 3 abortions were there, 2 MTPs, and 3 are still on follow-up. The prevalence is 47.7%. And in all the people who are positive, high risk was, in all the people who are positive, that is 43, all were having high risk human papillomavirus. And among these 43 people, 18 people had intermediate risk and 3 had low risk among these people only. And that means all of the patients had high risk human papillomavirus isolated. Among the demographic characteristics in the people who are included in the study group, the age was 28.1, the mean is, and control group 27.3, and it was not statistically different. And the marital life was statistically significant with the mean of study group is 3.6 and control group is 2.8, and p-value is 0.04. Number of pregnancies. Number of pregnancies till now was not statistically significant, and the BMI, higher the BMI, there was more association with human papillomavirus. Complications during the present pregnancy, like white discharge per vaginum, threatened abortion, gestational hypertension, gestational diabetes, and abortions, nothing was found statistically significant. And in the outcome, the babies with IUGR or the mothers who had pre-labor rupture of membranes or premature pre-labor rupture of membranes and premature delivery were considered. And there was significant association in preterm pre-labor rupture of membranes and pre-labor rupture of membranes, the p-value being 0.02. Conclusion. Incidence of human papillomavirus in pregnant women was around 48%, which is fairly high compared to that of general population that are associated with high, and all are associated with high-risk human papillomavirus. And in my study, I have seen more abortions, pre-labor rupture of membranes, and preterm pre-labor rupture of membranes, and preterm delivery among the pregnant women who had high-risk human papillomavirus infections, but only pre-labor rupture of membranes and premature pre-labor rupture of membranes were statistically significant. However, we need a larger sample size to give statistically significant difference in the obstetric and neonatal outcome. And also, my study was in a tertiary care center in which confounding factors may be there that have to be excluded. Thank you.
We open the stage for the judges. Do we have anything to discuss?
Yes, thank you very much for presenting this. I just wonder, do you feel like, were there any limitations in the study which you did? You collected some very good data, but do you feel like there were, can you hear me?
I can't.
Yeah.
Do you feel like you had any limitations in your study?
My study was a small study, and it was in a tertiary care center where affluent group of people come. So there are it may be different from the general population, where people are little uneducated, who get married in an early age and who become mothers in an early age.
Right. So for your particular population, do you feel like, what do you think kind of stood your study population aside from the general population?
They are more educated, and marital life, it is generally around 20 years the mean age of marriage is, but this mean age of marriage is more higher, and they generally take little gap during the marriage and the first pregnancy, so they have more marital life. That is what I feel.
Okay.
Hi, thank you. Do you have any information about the history of the patient? If a patient had a PPROM previously, she would probably be in a higher risk, and I saw that some of the patient, it wasn't their first pregnancy.
Like hypertension previously, the people who had whoever had gestational hypertension in this study group, they never had gestational hypertension previously. I've gone back and I've seen, I've taken all the histories.
So that's for the hypertension, but for the PPROM?
PPROM, most of them who had PPROM, this is their first pregnancy.
Okay, but I think it should be excluded, so your statistics will be designed better.
Yes, sir.
Vani, one last question. Considering, though it's a small sample size, are you looking for some kind of a recommendation if it was a bigger sample size? Do you think it is worthwhile looking at HPV virus if you're going to modulate for preterm labor and PPROM, if you're doing a bigger study? What is the take-home message that you would probably get from what you did?
Ma'am, actually, in pregnancy, we see, I saw this much number of people having high-risk human papillomavirus, but we have to see if in the same area, there is the same samples, prevalence of human papillomavirus among normal people, and we don't know the difference. It could be like it is an immunosuppressed status, and there is little more increase in detection of human papillomavirus, and it could subside after delivery. And during pregnancy, actually, there were studies in which they told there are some placental infection in which human papillomavirus was isolated, and the people had preeclampsia. I could not find anything significant in my study like that, but there were studies outside, not in India.
So it needs to be extensively researched. That's what
we have to research it now.
Thank you so much. Yes,
thank you.
Just one last question. Neonatal outcomes, what did you find with the neonatal outcomes? The neonatal outcomes.
The mean age of outcomes,
the
prenatal outcomes, yeah. The prenatal outcomes.
Perinatal outcomes for the baby. What happened to the babies?
The babies are fine, sir. All babies are fine till now. Whoever delivered, Apgar's scores were good, and the babies are fine.
The NICU admissions?
No.
They didn't. Fetal growth restriction was also not noted.
Fetal growth restriction is there in both, but it was like tolerable only. The babies came out well.
So there were multiple confounding factors, so difficult for us to tell it was HPV, right?
Yes, ma'am.
Okay.